Osteoarthritis is a very common disease that affects joints throughout the body. It's essentially the wear and tear of joints that happens over time.
We as humans are not really designed to be up on our feet for the majority of our lives, and a lot of our work entails being up on our feet. And that in itself can cause a lot of stress on our joints, and mainly on our knee joint.
People, they want to be able to spend time with their families, go for hikes, go swimming, spend time with their grandkids, even just getting up out of the bed without pain or having to use a cane or a walker to get by.
It affects you throughout your daily activities. Knee pain is significantly lifestyle limiting.
40, 50 plus is when we start to see people kind of report and say that they have knee pain. 65 and up tends to be the most common demographic of people that get knee pain. It's the most common type of osteoarthritis in this country. So GAE stands for genicular, which is knee, artery embolization. So the concept behind this is that there is inflammation in your knee when you have arthritis and osteoarthritis.
It's a pretty fascinating procedure. We start by evaluating the patient here in clinic, making sure that they are a good candidate for GAE. And then once we establish that, we bring the patient in the morning, we make sure that we can safely sedate them, and then we'll have them be evaluated by our nurses, bring them into the room, make sure that they are comfortable, and then everything is done through an IV. And that's the beauty of minimally invasive. There's no major cutting, there's no longer recovery afterwards. Everything is done through an IV that we start in the groin area or in the wrist, and then we find our way under X-ray guidance using tiny little tubings, catheters, into that area that is inflamed, and we can actually see the inflammation under X-ray, and then block the arteries, which are the tiny little vessels that are in that area where it's inflamed. The idea behind it is that reduce that inflammation by starving that area from blood supply. The whole procedure takes about an hour. Recovery from it in our clinic here afterwards for about a couple hours, and patients go home the same day. Before seeing patients here in clinic, patients usually have gone through medical management, have met their orthopedic surgeon, have talked about the surgical options. Minimally invasive, that's where it comes into play. It's for patients who are on their way to surgery. They're not ready yet for surgery, and that's where minimally invasive procedure like GAE comes into play.
After about a few weeks to a couple of months, it's really when the maximum benefits will kick in. The patients will quickly tell us that they feel an amazing improvement afterwards. One of the things I hear from patients is that when the knee pain goes away, they feel like they can get their life back. They're able to go and travel and spend time with their family and friends and do the things that they hadn't been doing for years.
So VIVA has a long history here in the community. We've been open for almost 20 years, and we have staffed VIVA with high quality physicians that come from different backgrounds. We offer patients here in the community a low cost outpatient option. If I had the option as a patient to be treated in the hospital versus in an outpatient, more controlled, more relaxed setting, I will be choosing the outpatient setting.
The difference with VIVA is that our staff are incredible. They treat you like family. So you're gonna get our 110% every single time. GAE is becoming the least invasive treatment option that there is to treat osteoarthritis, and also the one that provides the fastest recovery time. A lot of people think that, oh, I'm just old and I have knee pain and that's just how it's gonna be for the rest of my life. It doesn't have to be the case. You don't have to live life that way. If you're looking for pain relief for your knee pain, GAE could be a great option for you. So give us a call, we'd be happy to see you.